Okay, so I'm going to be talking about oral cares for your patients who are on ventilators. So we make sure to do oral care every 2 hours to prevent ventilator-associated pneumonia. This way we just keep the patient's mouth clean and keep bacteria from growing, and making sure that we're keeping our patients as healthy as we possibly can. So you'll get your little oral care kits, and the first thing that will come in the first packet is these lovely little pieces. And so this is like a Y piece that can go to your wall suction, so you can have two suction tubes going at the same time. And then the next thing is this little control nozzle that has like an on and off switch. And then this will connect to your suction tubing, and then this end, all of these pieces will go interchangeable. So the first one that I hook up is this little just suctioning, and it has this nice little bag that goes back over it so you keep it clean, so it's not just like laying in their bed touching all sorts of things. So of course the first thing that I would do would be to go in the patient's room, wash my hands, put on gloves, and then set all of this up. And then suction my patient's mouth out, and then I'll grab the next kit, and it has a swab, some toothpaste, and this little toothbrush that I can just put on here. So with the suction off, I will get some toothpaste on my toothbrush and then brush my patient's teeth, make sure that I'm getting their molars and their tongue, and I'll gently rubbing their gums, little circular motions, both sides, top, bottom, left, right, getting everything, and then turning on the suction on that, and then I can, kind of brush their teeth and suction stuff up as I go. And I can put this other section on here and suction more if I need to. And then the next thing that I will do is get this little swab, and then we have some mouth moisturizer. So I'll put the mouth moisturizer all over the swab and then go throughout my patient's mouth, getting the inside of their cheeks, their tongue, their gums, all of that, making sure that we're not letting their mouth get too dry. And then I will come back in 2 hours and grab the next one, and it is another suction catheter. So with this one, again, put this on here, and then I can suction out my patients, just kind of get deep back farther in their mouth and into their throat, suction that on the outside of the ET tube. Most ET tubes have the suction that you can go and suction down the tube, but this will kind of get the stuff that's piled up all around it. Just again, keeping their mouth as clean as possible. Put this back on and suction them again, and then come back in 2 hours and pull out my next one. And this one is the little sponge that connects to my suction, and then I have another kind of toothpaste type stuff that I'll dip in here and then go through my patient's mouth, and make sure they get their cheeks and their gums and their tongue and everything. And then my little swab again, and my mouth moisturizer again, putting this and going all over their mouth, making sure that we're keeping that nice and clean and nice and moisturized, and that we're not letting any bacteria grow in there.